As for my topic today, it's not really far from what Shivani has just it's just from saying. So it's also closed craniocerebral injuries. So closed craniocerebral injuries happens when there is non-penetrating injury to the brain with no breaks in the skull. A closed brain injury is caused by rapid forward and backward movement of the shaking of the brain inside the bony skull that results in the brushing, the tearing of the brain tissue and the blood vessels. Closed brain injuries are usually caused by accidents, falls, increasing in sports, shaking of a baby, and also result in the type of injury. So it's called the shaken baby syndrome. Continuing. So what happens to a closed brain injury? So in a closed brain injury, what happens is there is a non-penetrating, as already said, um, non-penetrating injury to the brain with a non-break in the skull. A closed brain injury is caused by a rapid movement. So as we can see on the small diagram here, we can see some bruises that we can tell, okay, that this person is hit by having some scars, some fractures, and some nasal bleeding that we can tell that, okay, there's something else going on. So the damage in the brain can be in a form of brushes, as we see, and the concussion just by mentioned by Shivani, or it can also be bleeding around the brain and internal cranial hemorrhage. Continuing. So the classifications of intracranial classifications of intracranial injuries. We have, first of all, they are divided into three. We have the primary and secondary injuries, which includes the acceleration or declension from the instriction movement of the head, leading to the shear or tearless of the compressive stain. The forces can cause intracranial hematoma, diffuse diffuse scapular uh, injuries and injuries to the cranial nerves and the pituitary stalk, while the secondary injury is caused by the start of a process impacting the cerebral blood flow, which is hypo or hypofusion, impaired cerebral autogranulation, and cerebral metabolic diffusion of the impaired cerebral oxygenation, which can lead to ischemia and edema as the type of the secondary injury. Uh-huh. And the second type, we have the opening and closing injury, whereby the opening it's it's the penetrating injury that occurs from the impact of a bullet, for example, a knife or any other sharp object that forces the hair, the skin, the bone, and fragment from the object to the brain and to the dural matter in the brainage. The area of the damage is determined by the trajectory of the object and the possible recoordinating of the traveling difference density tissues. So here we have the scalp compared to the brain, whereby in the closed one is an injury of the brain caused by the outside forces without any penetration of the scar. The most serious complicated is the brain edema within the constriction space of the skull and resulting in the intracranial pressure and the compression of the brain structure and the cranial nerves. Mhm. And our last type is a vocal and diffused injury. As we can see on the diagram here, it's usually due to the construction and the causing of the scalp injury. It may be present in the skull fracture, continuous, or in intracranial hemorrhage. Those injuries are detected by the CT, MRI, or the PET structure, concussion, caps for conditions, and the contri- constriction, constriction, which is a direct opposite of the impact side. This um, this mechanism is related to the moving of the intracranial content in the scar and impacting on the intracranial surfaces of the scar. Commonly observed injuries of capped uh, or capped injuries are presenting in the concussion of the opposite side of the brain. So it's like a moving of the brain from its original state to the like hitting the other side of the scapula. All right, continuing. So this one is the other type, which is the diffused one, whereby it's usually due to the acceleration and injury of the concession resulting in the diffusion axoid injury DII. The brain swelling. A diffuse axoid injury is difficult to diagnose with common available CT or MRI scan. In demonstrated by the histological white matter injury of the cerebral hemisphere, the corpse uh, colossus, the brain stem, and the less commonly the cerebellum. A diffused axon injury may be accompanied by some force communication metabolism processes. This disturbance in the brain can produce temporary and permanent widespread brain damage, for example, coma or even death. The shaken baby syndrome is a type of a diffused axon injury. For example, these injuries are commonly found together. Mhm. And symptoms of a closed cranial brain injuries. Okay, so due to the traumatic brain injury, depending on the degree or of severity, we include the medium, the moderate, the severe, which includes, for example, nausea with its middle type, dizziness, loss of balance, problems with speech. But as it goes further, like you're not healing, you may have sudden swelling, bruises behind the ears or around the ears, dilation of both pupils of the eyes, and conversion or seizures. Mhm. So, in terms of treatment, we may have observations like to see in terms of levels of consciousness. We may have the mid painkillers of their headache, and to have nothing to eat or drink. Uh, um, Further advised, we may have anti-nausea tablets for any nausea and vomiting. We may have an X-ray of the neck. If you have a neck pain, you may have a TC scan if needed. And for a mid-head injury, it will be discharged from home and friends. Thank you.